I think as a parent, we're all always worried about our kids, and if you feel something isn't right, it's worth getting it checked out. We think about scoliosis, or a curve in your spine, as an asymmetric growth of the spine, meaning that while you are growing, your spine is growing in a crooked fashion or curved as opposed to growing perfectly straight. I think the hardest question for people to answer is why that happens. The shorter answer is we really don't know. Most people are diagnosed with an idiopathic scoliosis, and idiopathic means no known cause. There's a lot of theories behind genes and causing asymmetric growth in the spine, and even though we may not know the exact cause, we are well equipped to treat the condition. Most people with scoliosis don't have any symptoms other than the visible shape of their spine. It doesn't cause any pain or discomfort. It usually doesn't cause any neurologic symptoms like weakness or numbness or tingling. But oftentimes we see things like your shoulders being higher than the other, a crease in your side that isn't on the other side, feeling like your trunk is shifted to one way or another. And then oftentimes when you bend over, it looks like the ribs on one side of your back are higher than the other. I think it's never too early to screen for a condition. The American Academy of Pediatrics recommends that scoliosis screening occurs twice for girls, roughly at ages 12 and 14, and once for boys at age 14. Most pediatricians are screening children way more frequently than that, and that's totally okay. A screening is a great way to catch somebody with a curve that's early, and like with most progressive conditions, the earlier we find it, the better chance we have at preventing that curve from becoming something that needs surgery or more significant treatment down the road. In general, screening kids under the age of 10 probably isn't required. However, we do see children under the age of 10 with curves every once in a while. So our treatment of scoliosis is based on two main factors: how much growth your child has left and how big that curve is. Assuming your child is still growing, for curves that are between 10 degrees and 25 degrees, we treat that with observation only. So that means we take an x-ray every 6 months or so to make sure the curve is not progressing. If we ever see the curve has progressed past 25 degrees and is under 40 degrees, we consider a brace. The goal of a brace is to push on the spine and make the curve straighter while you're wearing the brace. We're trying to guide growth at that point. We're not able to permanently correct the curve, but in many cases, we're able to prevent it from getting bigger. Ultimately, we want your curve to be under 40 degrees when you're done growing. In that case, your curve shouldn't progress any further and will stay that way for the rest of your life. In those cases where the curve is over 50 degrees, that's when we consider surgery to permanently correct the spine and really more importantly to prevent any further progression of that deformity. Understand that the vast majority of patients that we're treating with observation. A much smaller percentage are getting a brace, and an even smaller percentage of that are winding up having surgery. Of the people that we're treating with scoliosis, under 5% even wind up with surgery. So know that the risk of your child needing surgery is incredibly low. Our pediatricians in the city are really fantastic and are really well equipped to guide you appropriately. That's what they're there for. They're there to be your resource and your sounding board. Having a diagnosis of something like scoliosis can be scary and terrifying, both for your child and for you as a parent. But also know that we're here to support you and guide you in your treatment and ultimately do what's absolutely best for your child above all else.